This is the first time I've come to a PCT camp um, held in Bailakuppe in near Mysore. I think there have been earlier camps in association with AIIMS doctors before, maybe one in Dharamshala and one in Hubli. I think the PCT is doing a wonderful job because it's difficult for monks or Tibetans living in Bailakuppe or remote camp areas to access top-notch health services like All India Institute of Medical Sciences. And if the AIIMS administration is willing to help and contribute, I think this arrangement between AIIMS and PCT will work very well. And it has been working for so many camps now, and it should work in future as well. Because doctors from All India Institute and other top institutions in Delhi, they collaborate with PCT and come down to the camps and see the patients themselves. Otherwise, it would be very difficult for people in these camps to actually access the doctors in All India Institute of Medical Sciences. And the doctors in AIIMS also get some time off. They come to these camps and they're located in very nice places. Like this Bailakuppe camp is a beautiful place. So it works both ways. I think it's a very good collaboration and it should continue in future. Maybe expand. If we could find a hospital where we could work, then maybe we could even get some surgical cases also done.
Yes, sir.
Thank you. Shashank Sharad Kale. I am the professor and head of neurosurgery in All India Institute of Medical Sciences, New Delhi. This is the first time I came to a PCT camp in Bailakuppe. And I think it was a wonderful camp. We saw a lot of patients, helped them, at least cleared the doubts in some patients' mind. You know, patients always believe that if they can access the top doctors in Delhi, maybe their diagnosis would be best, or then that is like the best treatment available. So if you can get the AIIMS doctors here, so good for the patients, so good for the patients. And even in future, I would definitely be willing to collaborate, and I am sure there will be other doctors in AIIMS also who would be willing to collaborate in future camps organized by PCT.
First, please give a brief introduction of yourself,
Right.
your
I'm,
name, and what is responsible.
I'm Dr. Uma Kumar. I'm professor and head Department of Rheumatology at All India Institute of Medical Sciences, New Delhi.
Yes. Okay.
And actually, I'm head of Department of Rheumatology. Rheumatology is a subject which deals with various rheumatological illnesses. That means which deals with problems of joints, muscles, ligaments, tendons, and other soft tissues of the body and the autoimmune diseases.
Many doctors from AIIMS want to Sera monastery to provide free medical checkup and treatment for patients. Yeah, could you please give a brief opinion about this?
Yeah, actually, this opportunity has been provided to us by the Patient Care Trust, which is actually working for last many years to serve the people in remote areas. And we doctors at AIIMS, you would understand there is too much of workload at AIIMS. The patients are referred from all over India and also from abroad. So, but this way we could come to this place and serve the people of this monastery, and it has been a wonderful experience. And I would say in general people in this monastery are healthy, but the majority have dyspepsia, which means they have acidity issues, and they have some problems in the joints, like pain in the joint, not arthritis, which could be because of their weight, because I found couple of them are actually overweight. And there's something called degenerative joint disease, that means aging joint, and that is called osteoarthritis, which also is found. But we did get some patients of serious types of arthritis like rheumatoid arthritis, Sjogren syndrome, and spondyloarthritis in the younger population.
Any other suggestion without my question?
Suggestions for the people, I would just like to tell that if these such camps are widely advertised so that the people from very far-flung areas can also plan their visit accordingly, because I understand that these places are very difficult to reach. Like it took a couple of hours for us to reach to this place from Bangalore, so you can understand, and there are difficult situations. So, at last I would like to say that the Patient Care Trust has been doing wonderful job, and the monastery has provided us all kinds of support in terms of dealing with patients. Like you saw, I have interpreter who's actually helping me and understand patients' issues. So even those things are being taken care of very nicely. So I thank them for this.
Thank you.
Thank you.
Good morning everyone. My name is Dr. Amol Raheja. I'm an additional professor in neurosurgery at All India Institute of Medical Sciences, New Delhi. I have been privileged to have participated in the past 3 years medical camp run by Patient Care Trust under the leadership of Mr. Sonam Bongya, and which is a unique collaboration which is happening for Tibetan community in exile and our institute at AIIMS, where many faculty have been coming for community service at various medical camps across the country, and it has provided great opportunity for us to also see the Tibetan patients who have been settled in our country and take care of their medical needs. I believe this camp has been running for the past 6 years and has been fruitful for the community at large, and I wish that there should be continued support and partnership going between our institute and the Patient Care Trust for coming for the forthcoming years, so that we can help the people in need wherever it's possible. In my experience over the past 3 years, I've seen and I've probably referred back at least I would say more than a dozen patients who needed a neurosurgical procedure, sometimes in an acute stage or sometimes in a separate setting. And it has helped them to, and I believe the trust has helped them to get the medical help needed for them as far as the neurosurgery is concerned, I can say for sure. And they have been instrumental in sending the patients to our institute, where we had operated on the patients, and the patients have been doing quite well. Overall, what I've seen is that this medical camp has its unique capability of catering to different sections of the community, starting from pediatric age group to an elderly, having different needs, whether it's the medical aspects or surgical aspects, gynecological aspects, or other rehabilitation related aspects. Thank you.
Good evening. I am Dr. Rajesh Kumari, additional professor from Department of Obstetrics and Gynecology, AIIMS, New Delhi. So I want to discuss about Patient Care Trust that was running by Mr. Sonam Bongya since 2012, and he is continuously helping community by arranging these health camps for vulnerable people who cannot reach directly to the doctor, and there is little bit language problem with them, and there is also monetary problem is with them. So Mr. Sonam is helping by arranging these camps. I think this is my 4th camp with the Patient Care Trust from AIIMS-Delhi, and this is well preserved Patient Care Trust, and there's this unique collaboration between community, vulnerable community, and doctors and volunteers from Patient Care Trust, so that they can help us. We are only doctors, but these volunteers, they can help us about language barrier. They can translate what is their problem. They can easily tell us, ma'am, this is their problem, so we can examine and we can treat them accordingly. So this is a long-term work relationship between AIIMS-Delhi and Patient Care Trust. And the last, I would like to say thank you Patient Care Trust and Mr. Sonam Mangal to arranging these camps to help the community who needs help regarding health. Not only health, education, awareness, everything is important. By these camps, we are doing all these things. We are educating them about their health risk factors, about their awareness regarding new drugs or disease, everything. So, at last, I want to say thank you again to Mr. Sonam Mangal. Thank you. I would like to tell something about you, this unique camp. This camp was successful because of help and support of our director sir from AIIMS New Delhi, current director sir, and this camp is arranged at Balakupa, Karnataka. There are many monasteries are here, and I think there is biggest monastery at Balakupa. And in this camp, we have done many screening programs also, like cervical cancer screening, breast cancer screening, oral cancer screening, and pulmonary lungs related complaints, like Dr. Vijay Hadda, who is additional professor from pulmonary medicine department from AIIMS. He is here for this pulmonary medicine health issues, and also we have done health camp for eye checkup also, that and for I have already told the cervical cancer screening, and gastrology, that is most important, gastrology, because there are some food habits are different here, so gastrology that is also important. So we have we were like a team here, and we worked in a team with all the Patient Care Trust volunteers and monastery people and everyone who is working here. They help us to make successful this camp. Thank you.